It's 9:33, and last week the CDC Advisory Committee approved authorization for a third Pfizer booster shot. But the recommendations came with some guidelines of which Americans are actually eligible. Joining us now is Emory University's Dr. Neil Winawer. Good morning, Doc. A lot to sort through here in terms of the constant moving parts in this conversation about COVID and vaccinations. People 65 and older, residents of long-term health care facilities can now get Pfizer booster shots. But the CDC voted 9-6 against boosters for a broader group of people, those between the ages of 18 and 64, who are actually at risk for COVID because of their workplace or institutional settings like healthcare workers. But the CDC director disagreed. So what's your opinion?
Yeah, I don't know how many of those committee members serve on the front lines. And I just completely agree with Dr. Walensky's overruling here because there are really two big reasons. Well, first, let's talk that, you're still protected as a healthcare worker. You're still protected against hospitalization, severe illness, death with the two doses. However, breakthrough infections are becoming more and more apparent. And as a healthcare provider, I do not want to pass along an infection to somebody who's vulnerable and who may have a difficult time with the infection. And then secondly, we've seen how burnout has become a big problem because healthcare providers, nurses and doctors and techs and aides are all being asked to do more. And if we have a significant portion of the workforce go down with illness, even though they may not wind up in the hospital, but they're unable to take care of critically ill patients, that's a big problem because we've already seen healthcare rationing. And it's very important that we don't overburden the number of patients to healthcare provider ratios, because once you do that, patients start not getting the care that they need and you can see worse outcomes. So there are two big reasons, I think, why she diverged from this advisory panel's 9-6 ruling.
So what do you say to those who say we shouldn't be giving boosters here in the U.S. until those with low resource countries have had a chance to get fully vaccinated as well?
Yeah, I think we're going to have to do both. I don't think we have a choice. I think it is true we are not going to boost ourselves out of this pandemic. That is obvious. We need to be able to increase the doses among the unvaccinated. And then there are 15 countries in the world whose vaccination rates are under 3%. They're mostly in Africa. And I think we have to give billions and billions of doses to these countries. And I don't think we're going to be able to gift our way out of the pandemic either. We're going to need to provide these countries with the resources that they need to ramp up their own production. But given the number of breakthrough infections in this country too, I think we're going to have to do both. And there's no reason why it has to be an either or. We have to do both. It's an and.
Understood. And what about the Johnson & Johnson vaccine, which has been lost in all these booster discussions? Almost 15 million Americans received that particular vaccine. Any news on when they're going to be, when a booster is even going to be approved?
I don't have information when a booster will be approved for those individuals. However, there was good news last week on two fronts regarding the J&J vaccine. One was the 2-dose series when people got a second dose 56 days after the first dose. They wound up having close to 95% protection against severe illness. And if you waited even longer, if people who got J&J had waited 6 months and then got a second dose, then their protection was actually 100% against severe illness. So it's really good news. And for those who've only gotten one dose so far, obviously these are all the people who've gotten the J&J, their protection is still pretty robust. It's close to 80%, including the Delta variant. So even though people who might worry that they're not getting the booster and only got one dose of the J&J, I think they could breathe a little bit easier knowing that they have significant protection still and that booster shots will be on the way. And when they get those boosters, they're going to be even more protected. So I think that's very favorable news for those individuals who were worried about that.
Gotcha. Still a lot more work to do in this fight against COVID-19. Dr. Neil Winawer, thank you so much for joining us from Emory University this morning.
My pleasure. Have a great week.
Thanks, you too.